Hi everyone, my name's Alex, and I'll be presenting for Group 4, or Generalized Anxiety Disorder. So, Generalized Anxiety Disorder, often called GAD, is an incredibly important topic because anxiety is one of the most common, if not the most, emotional challenges or disorders that students and adults face. Understanding it can help us become more supportive teachers as well as more supportive classmates or peers to these adults and students in our classroom. So, what is a general anxiety disorder? So, general anxiety disorder is defined as an excessive anxiety or worry that occurs for more days than not in at least 6 months. That means out of a 6 month period, it's occurring for more days than it is not. And it focuses on a wide range of life events or activities. This can be small things or large things. The definition comes straight from the National Institute of Mental Health, or NIHM, which is one of the leading or top authorities on the mental health research programs. People with GAD don't just worry about one little thing like a test or a specific life event. Instead, they feel constant, uncontrollable anxiety about many parts of their life, even small ones like everyday tasks. This worry can often feel impossible to shut off or impossible to avoid, especially when there's no clear reason or cause to anxiety. A lot of times people can't pinpoint exactly what it's coming from, and so it's difficult to grapple. So, some other facts and details. Generalized anxiety disorder is considered an umbrella term, often because of its overlaps with anxiety-related disorders such as obsessive compulsive disorder or OCD, panic disorders where panic attacks occur, post-traumatic stress disorder or PTSD, and lots of different types of social anxiety disorders. It falls under specifically the emotional disability category when we think about it from an educational perspective as well. One thing that's super important to remember is that GAD it can be a long-term condition, and most of the time it is, but it's also highly treatable with many different types of treatment, such as therapy, different coping strategies, and sometimes even medication can help. Many people are able to manage their stress and anxiety and live full and productive lives. According to Mayo Clinic, treatments like cognitive behavioral therapies and relaxation techniques are especially effective. So let's talk about some different kinds of symptoms. Symptoms can look very different. They have a ton of different shapes and forms they can take for different people and situations, but some common ones include constant worrying or expecting the worst, overthinking, especially when you overthink many outcomes, seeing normal situations as threatening, having trouble concentrating or focusing on tasks, or feeling restless, tense, or unable to relax. Uh, Students might also describe this feeling as not being able to shut off their brain or silence their brain, which this may seem like distracted or maybe even jumpy. According to the NIMH, adults with GAD often report having the feelings of fatigue, muscle tension, and difficulty sleeping. Children can experience these on top of different effects such as perfectionism or worrying too much about their grades, as well as trying to control different situations to make sure that they feel safe in the situation. Let's take a look at some statistics. According to the National Institute of Mental Health, about 2.7% of US adults experience generalized anxiety disorder in a given year. Um, but only 43% of those adults receive treatment, which shows that a lot of these people are going untreated and they are not like receiving the assistance that they really need. Also, it's more common among women than it is among men. About 3.4% of women compared to 1.9% of men experience GAD each year. The Mayo Clinic notes that this might be because of hormone changes, stress levels, and different biological factors. These things probably all have a role to play in the difference. Finally, the average age of onset is around 31 years old for diagnosis, but symptoms often begin much, much earlier, well into childhood. So it's easier when they are recognized earlier in life, but diagnoses normally come much later. So, what are some signs that we see in the classroom of GAD or general anxiety disorder? When it comes to the classroom, Teachers have a big role in noticing early, which is a huge pressure. A student with general anxiety disorder might come into school very prepared, or they might come to school not prepared at all, depending on how their anxiety is affecting them specifically. They might obsess over homework, um, feel anxious when called on, or even shut down completely during group or tests. Especially with grouping activities, many times social anxiety can also play a role into that, which these two things are generally connected. Um, One thing to remember is it's not always obvious. Sometimes anxiety can look like defiance or avoidance. A good example of this is a student might refuse to participate, not because they don't care, but because of their fear of failing or being embarrassed. So a certain environment needs to be built up to avoid these feelings. Specifically, students living in unstable or unsafe environments might have anxiety about the safety of them or their family, which will affect their ability to focus and learn day to day in the classroom. So, how do we manage general anxiety disorder in the classroom? I am going to go through a little small list of different strategies we can use to support general anxiety in the classroom. A lot of these are sourced directly from the behavioral health and the Mayo Clinic recommendations. So the first one would be promoting coping strategies and adaptation skills. This could include the teacher teaching different breathing exercises, journaling, whether that's emotional or literal, or giving students time to calm down in calm down spaces when they're feeling overwhelmed. A second one would be to match challenges to the students' abilities, to avoid overloading students with pressure, and to give them choice. You can break bigger assessments or assignments into smaller steps and reorganize the effort so that it feels more digestible and less stressful. A third one would be more consistent support and communication. So students with GAD often benefit from routines. This means that when you build a heavy routine for your classroom on the day-to-day or even on a weekly basis, there's going to be a lot less anxiety about the situation in general. A fourth one would be to engage in family involvement. Open communication between families, homes, and the school ensures that students get consistent support that they need and that they are being fully understood. Finally, promoting positive peer relationships. Group activities and group conversations can be one of the most stressful bits, but with guidance, peers can learn empathy and a lot of inclusion skills that encourage structured teamwork that will reduce anxiety and build confidence in students that are anxious about the situation. Some interesting facts. So, there are a few interesting facts to know about GAD. According to the American Academy of Pediatrics, anxiety disorders are among the most common mental health problems in children and adolescents, and they can appear as early as elementary school. Another one is that women are most likely are twice as likely than men to develop GAD, and although the symptoms can be appear at any age, they are more likely to show up in childhood or younger ages before teenhood. Uh, Another thing is that the symptoms overlap with many panic disorders and OCD, which can make it incredibly difficult to diagnose the correct way and have an exact diagnosis. Final bit, here's some resources for us. Some of them I quoted directly, and some of them I gained some information from. The first one is the National Institute of Mental Health. Super great, has a lot of great information, especially on mental health disorders and emotional disorders. The Mayo Clinic, which I pulled a lot of different resources from and activity ideas or like assistance ideas, as well as the Anxiety and Depression Association of America, which really helped shape the idea of the whole presentation. On top of that, finally, the American Academy of Pediatrics. So to focus on children's health specifically. To wrap up the whole thing, generalized anxiety disorder is one of the most common emotional disabilities with some of the most manageable symptoms, meaning that it happens and occurs very commonly. However, there are so many different paths we can take to help our students and to help the people around us. As educators, our role is to notice the signs and create a calm and predictable classroom with students that have empathy and inclusion understanding, as well as communicating openly with students and families to make sure the support is accurate. By helping these students develop coping skills and showing empathy, they can make a real difference in the ability to learn and stay safe or feel safe at school. Thank you so much for your time. Hope you guys have a great day.
An accommodation for generalized anxiety disorder is a cool down pass or break station. Students with GAD may become overwhelmed by sustained demands, transitions, or stressors. Examples are difficult questions, peer pressure, and time pressure. Having a safe way to pause, breathe, and regroup can reduce and maintain engagement in a lesson. Allowing a take a break or cool down pass is often recommended, physically leaving the classroom briefly to a calming space and so that the student can calm down using mindfulness apps and doing a regrouping activity. An example of this could be a student starts fidgeting or getting anxious, showing expressions that might lead you to worry. You could have them get a cool down pass, hand you a cool down pass, and they could step into this area for a short 2 to 3 minutes to reset using breathing activities, quiet coloring, listening to calm music, doing a guided exercise, using that audio to calm down. It could really just depend on the teacher, but it's really easy. You could just use a calming down pass, have a designed break and station area, have a short playlist of calming sounds, signs reminding the students what this pass means and what you need to go into this area, and then a timer or visual cue to limit the break. The second accommodation for generalized anxiety disorder is advanced notice and structure. Students with GAD thrive on a routine, sudden changes, ambitious expectations, or long-term open-ended assignments can trigger significant anxiety. This accommodation focuses on increasing structure, clarity, or forewarning in the classroom environment. So I provided pictures, and those are some examples of what teachers could do as a calendar. It can show your overdue, what you need to do still, etc. And then post a weekly schedule. Each week you can post what assignments are going to be done this week. And then for big tasks, you can create 3 to 4 steps and create them in little chunks so it doesn't stress the students out. So the material setup checklist, recording for students to listen to, share a calendar of the month, week, whatever the teacher decides. It can be printed, short rubric. It could be most likely one-page prompt. Examples of assignments and problems that students can go based off of.